And to put this into context, globally there are about 60 million refugees and internally displaced people today. That's more than since World War II. So 1 in every 125 people in the world is a refugee. And the groups in Europe, there tend to be two main groups. One is Syrian refugees, who tend to be families, a little higher educated, a little higher income. And then you get young men, unaccompanied men, coming from Afghanistan, Pakistan, Iraq, and from Africa, and they often have different needs. As far as the medical needs, the first immediate needs are injuries that may have been sustained during their journey, or they may have picked up diarrhea or upper respiratory infections. Many of the older Syrian refugees have chronic conditions such as high blood pressure, diabetes, or heart and lung conditions. Many of the women refugees may have special needs. They may need birth control. They may have been raped along their journey. They also may be pregnant. There's also much higher rates of mental health problems in refugees, either long-standing problems or problems that were triggered by the experience during their journey. And the second major concern that health workers often have in refugees is that they may bring in new infectious diseases. And the biggest concern here is that of multi-drug resistant tuberculosis.
Now, some healthcare workers aren't very optimistic about these new initiatives. In fact, Doctors Without Borders decided not to attend the World Humanitarian Summit over concerns that governments won't be required to act on these initiatives. What do you think about that?
They were a major planner, but they have felt that the nations of the world are not doing enough to protect refugees, and also especially are not doing enough to protect MSF, their health workers and health facilities. About 75 health facilities run by MSF have been attacked, purposely attacked, over the last year. And there are rules of law, rules of war that cover and protect health workers and health facilities, but these just aren't being followed. And in the planning for the humanitarian summit, it was planned to have commitments or planned to have agreements, but none of these would be binding. And I think that's what had concerned Medicine Sans Frontiers, that the results of the summit wouldn't be binding.
And in terms of people having to step up, you have governments, there's also NGOs, perhaps private enterprises. How are they able to fund all these crises that are going on at the moment?
Money definitely is tight. The NGOs have launched special campaigns to try to raise more money. European governments are starting to divert funding that usually would have gone to Africa and Asia for peacetime development work, health and education work, is being diverted towards the Syrian refugee crisis. And recently Europe has dedicated about $7 million additional dollars for the refugee crisis, and the U.S. has donated about $400 million. But the continued funding is a real concern.
Now, obviously, another group that's very vulnerable is the young, and we're actually saying that the UN is saying that young refugees could be a, quote, lost generation because they don't have adequate access to the right nutrition and the right medical care at a very critical time in their development. What do you make of this?
Yes, exactly. As a pediatrician, this is something that I'm very concerned about. There's a certain window of development and window of opportunity for children as far as both their health and their education. And it's estimated that some of the current refugees will spend as many as 20 years in refugee camps in sort of a legal limbo, not cleared to enter a country, but not safe yet to go back home. And so as much as possible, the NGOs and governments running the camps are going to try to provide primary health care, good nutrition, education, vaccinations, but there really is a concern of an entire lost generation of people.
And you also mentioned with this, obviously, this mass movement of people putting a lot of strain on a lot of different healthcare systems. What do you think are the biggest challenges there?
Well, in areas where there are only a few refugees, some of the health systems can absorb them medically, and you'll just mainly have needs for interpreters to do language interpretation. But in some countries like Germany, which has absorbed the largest number of refugees, you have very high concentration, and they will need to set up entire health systems to meet the needs of the refugees. And given the current health worker shortage in Europe, it may be very difficult for them to find sufficient health workers, especially health workers with the appropriate language skills. skills. One possibility is to identify the healthcare workers within the refugee population and enable them to start serving their communities again.
Adding to the concerns, you also have the head of the WHO saying that the world is ripe for the next pandemic and won't be able to cope with it. So in terms of that, what would you say are actually the biggest health concerns right now in the medical community?
Well, people talk about sort of these three slow-burning crises. You have the crises of global climate change and the expansion of mosquitoes into areas they weren't before. So you'll see different diseases. You have global aging and also the emerging of new pathogens, such as Zika and Ebola that we've seen. One bright note on the funding front: the World Bank has recently announced the formation of a pandemic emergency fund. This is a fund that will allow large amounts of money to flow to either governments or non-governmental organizations when it looks like a new disease is emerging. So this is a fund that's been set up actually in response to the Ebola and Zika epidemics.
If you like what you just saw, follow us on social media and visit our website, cctv-america.com.